Let's talk about the pelvis. So with the pelvis, we want to make sure that the patient has no lesions, no discomfort, no leaking, no bleeding. There's a creamy, milky discharge that's normal with pregnancy, the duration, but moms really should have no bleeding during pregnancy. And if they have a clear liquid tight fluid, then we have to assume maybe she has ruptured her membranes and that she's having leaking of the amniotic fluid. And so therefore we would want to investigate that further. And that's whether she's preterm or term. So some of the things that we would use for the pelvis exam, we have a sterile speculum exam, and this is how it's written. You make sure that it has what it is and the date that it was wrapped and sterilized. Here is the open sterile speculum. And so you open it and you lock it with this screw. And you want to make sure that your patient knows that there may be some pressure and there may be some discomfort with the speculum exam. It comes also with a sponge forceps. And with a sponge forceps, you can actually pinch the cervix if you need to, lift up the cervix if you needed to, or you could just have a 4x4 and you can wipe in the cervix and obtain a specimen that way. We always use either a single or a 2 sterile glove. So anytime we start to enter the vagina, especially with pregnancy, we're going to be using a sterile glove. We also will have Q-tips that we can again go into the cervix and we can obtain a specimen, or we may even actually need to use a specimen swab. And so when the patient is ready for her group beta strep specimen, this is what they use. And so this is how it looks. It's in a medium and it has a Q-tip, and this whole cylinder goes off to the lab. It opens sterilely, and the practitioner, whoever the practitioner is going to take this sterilely. And so we use this swab, go into the cervix, wipe around, and then go down through the rectum and try to collect cells there, and then we send it off. And this would be our group beta strep. We twist this off, put this in, twist it, and now it's ready to go. Every specimen that is sent to the lab needs to be addressed with the patient's name, date of birth, and or medical record number if you have it, the initial of the person who obtained, and the date and time. And it's important to do this at the bedside, not after you have gotten out of the room, so you don't confuse it with another patient. Also, every patient who comes into prenatal care, remember we talked about the initial would be a culture. After that, we're going to be getting a urine specimen. And again, same information, name, date of birth, whoever is sending it, time and date. It will go into a biohazardous bag, and they will go off to the lab. If we're just getting a specimen just for today, then we're going to do a urine dipstick. And we want to just dip it for ketones, protein, nitrates, just a quick dip, and we can read it against the grade here and can see if our patient has a urinary tract infection, if she has protein in the urine, if she has glucose in the urine. And we're suspecting that maybe she's gestational diabetic and she has a high level of sugar in her urine. So that's a way to quickly be able to assess what's going on with her urine. Also, this is a pH stick. So let's say Miss Pam Anderson today said that she's had leaking of clear fluid for the last day, and it just comes down her leg. She's not sure what it is. She thought it was urine. We can take this, put it against her thigh, or either let her wear a peri pad and have this in there, let her stand or walk around to see if we can obtain any of the fluid. And if it turns a dark blue, then we have to assume that maybe she has ruptured her membranes. But with this, also urine can turn it blue. So we want to investigate further. So if we think that she has ruptured her membrane, again, good reason to do an ultrasound, see what her fluid index is. Another way we can also do it is using the speculum exam, looking at the cervix, have her cough, and do we see any leaking or liquid from the vagina. Also, one other thing that we would do would be a vaginal exam if it's necessary. So we want to check the cervix to see, is it open, is it still closed, where is she as far as her cervical exam. And so we always use KY jelly, and then we're going to, if this were the cervix, we want to take 2 fingers and exam fingers, and we check the cervix this way. And so how many ever fingers we can fit, let's see, it was here, and we have a little opening there that's about 4 centimeters. And this is one of those things that you kind of learn along the way, and the more you do, the better you are able to assess a cervical